Hi, my name is Faith. I'm going to be talking about the skeletal system today. So this system is what supports our body and being able to function every single day, from being able to walk and move to making the red blood cells that are within our body. So I'm going to talk about the structures of the body system, their functions and risk factors, along with aging issues and some common disorders involved in the skeletal system. I'm also going to talk about just the information that a medical assistant should have and help in support this system and patients that have issues with this system. So the skeletal system is made up of 126 bones that are separated into two different categories. We have the axial skeleton that is made up of 80 bones and 26 vertebrae that include the the cranium and the ear bones, the ossicle bones, along with the bones that are in the neck and larynx, and then the 26 vertebrae that are in the spinal column. They also consist of the sternum, so like the rib bones and everything. They help protect all of the major organs. And then the appendicular skeleton is made up of 126 bones, and those are separated into two categories. They have the upper section, which is like the collarbones, scapula, the humerus, radius, carpals. And then they have the lower part that are like the leg bones and the feet bones and your pelvic girdle. This section allows for like the movement and range of motion. Inside of these two sections, there are 5 different types of bones. I have a diagram right here. They're flat bones that protect internal organs, along with the irregular bones that also help protect internal organs like the vertebrae. Short bones that help with stability like the carpals, and then long bones that help support your body's weight like your humerus. They also have the sigmoid bones that help protects the tendons like your patella. The tendons bring me to the connective tissues that are within the body system. There are 3 different types of connective tissues: cartilage, which helps with flexibility; tendons that help with attaching bone to muscle; and ligaments that attach bones to joints. And then there are 3 different types of joints as well that all help with different ranges of motion. Now, the function of the skeletal system is to protect the body's organs, obviously, and allow for movement and allowing us to get around. It also produces calcium, so our bones are strong. Inside our bones, they produce red blood cells. It also helps making new bones. The movement is the joints part. The risk factors that come with the skeletal system are normal ones like breaking bones, or like if you don't have enough calcium in your body, then you can have brittle bones and they could break easy. That would also harm your body in the ability to make new bones and help with the bones that are already broken. Most of the risks that come with this system are aging risks as well, which is loss in bone mass, loss in bone density. Your joints are deteriorating, so they're stiff and they don't function the way that they should. There are some risks that are pretty much strictly for people who are older, such as common diseases like bursitis and gout. Those are normally happen in people that are over the age of 40. They happen with repetitive movement or buildup of uric acid. The only thing to help with the bursitis is hot and cold compresses and the use of NSAIDs. For gout, they can be on long-term medications to help with the buildup of uric acid. They also can take medications such as colchicine that will get the excess uric acid out super quick, and it is an as needed rather than something that you take long term. lab test for both of those would be an x-ray and just lab tests in general, an MRI and ultrasound as well. Now there is one common disease, well, not so common, but common disease that is for infants, and that would be hip dysplasia, and that is the joints don't match to the bone that they need to be there. This happens to 1 in every 1,000 females, and it happens to mostly firstborn females of a woman. X-rays and CT scans are the primary way that they diagnose this, and they will have limping, hip pain, an unstable hip joint. A lot of the time, physical therapy and surgery will be used to help with this. They can do braces, and sometimes that does help. As a medical assistant, knowing this information, we'll be able to have it to where we can be the advocate for people who don't have access to this, such as if somebody has an issue with their spinal column and can't walk anymore, we can be the person in a doctor's office that says, hey, we need a wheelchair accessible scale, because I was in an office where they didn't have that, and we couldn't get the vital sign for that because they did not have the ability to get on the scale. They had only a standing one. So we can be the person that advocates for them. Also, having the medical understanding of this system and knowing the normal and abnormal signs and symptoms will allow us to be able to help the doctor in assisting with getting the right brace, because in some offices they do help with the brace along with the forming of the brace as well, and it also helps the patient feel more comfortable having somebody there that they know will be an advocate for them. And so us having a knowledge of this will not only help ourselves to know common signs and symptoms for ourselves, but it will also make it to where we can help the patient be able to actually have somebody there to make them feel comfortable and that wants to help. Not that doctors don't, but sometimes they don't have the best bedside manner, so we can be that person that has the good bedside manner for them. Overall, the skeletal system is the strength behind our everyday movements, and issues with that can lead to issues in other systems, such as the calcium and everything. The skeletal system is the main part for homeostasis, and so if we have an issue with this system, there's a good chance we'll have an issue with all the rest of them. So, thank you so much.